For those who aren't familiar with me, I am a holistic and integrative doctor of physical therapy, and I help families and their little ones heal holistically by addressing the root causes of colic, eczema, reflux, food allergies, food intolerances, food sensitivities, sensory needs, and more, so that your family can be happier, healthier, and enjoy your time together without the overwhelm, stress, or confusion. So now we've gotten to the part of the signs and symptoms of food allergies. And this is really important to me because part of my mission is helping to spread awareness of food allergies. Many parents may not know that some of these things that they see and that are categorized as colic, eczema, reflux are really a type of food allergy, and that there are multiple possible root causes or underlying reasons for the things that they are seeing, so that we cannot jump to conclusions and say that it is a food allergy without proper care. So let's go through some of the things that you may be seeing, and this comes into play, especially if any baby is breastfed or formula fed, and especially if they're experiencing these things normally or with a switch in formula. So if you end up going with a different brand and you see these things, these are signs and symptoms that this may be a food allergy that you are dealing with. And the next step is to work closely with a provider to help you figure these out. I also want you to know that there are multiple different kinds of food allergies. So there are things called IgE allergies, which are more well known, and there are non-IgE allergies. And these are the ones that are less known and that we commonly call colic or eczema or reflux. So let's go ahead and just start with digestive issues. So digestive issues can range from excessive gas. So excessive gas, farting, maybe baby is really uncomfortable when they're passing gas, and this is a constant problem. This is something that is going on often, not just once in a while. And this can also be constipation. So if your little one, no matter if they are breastfed or formula fed, if they are not having a bowel movement at least bare minimum once every 3 days, then they are constipated. And again, that can be a sign of a food allergy. The flip side of that is diarrhea. So if your little one, again, doesn't matter breastfed or formula fed, is having more than 6 bowel movements a day, and or, right, we can say and or they are loose, and baby may have pain when they are happening, and they are very liquidy or explosive. If there are many of those, that again is a sign, possible sign of a food allergy. Other things that you can see from the digestive system are gurgling, again, just discomfort and pain, and that can be called colic. So again, these are possible signs and symptoms, and I don't want you to jump to a conclusion that it is a food allergy, because there are other possible root causes to rule out first. So I just want to spread awareness about this. The next thing is fussiness. So fussiness is often called colic. So a child who is crying for hours every day, who is not comfortable no matter what you do, who needs to be bounced for hours, who is just generally uncomfortable. You can tell that they are not happy. This is your baby communicating to you. And again, it may be signs and symptoms of a food allergy or other things that we want to rule out as well. Same thing with worsened sleep. There are ranges of normal. So with sleep, our babies, biologically, it is normal for them to wake up often at night. Now, the difference is that when they wake up screaming in pain, that is not normal. When they wake up every 15 to 20 minutes, that is not normal. If they're extremely restless during sleep, that is not normal as well. So again, these are things to pay attention to, and to if this resonates with you, I encourage you to dig deeper and find a provider that can work with you to identify and address the root causes. The other things that we want to look for are rashes. So skin changes like eczema or hives, those kind of skin changes are things that may be signs of food allergy as well. Now, especially if your baby has hives, I need you to go see your urgent care or ER if there are hives that come up, especially with switching formula. and you will need care of an allergist. So that is something that I absolutely recommend if you are seeing that. Now, at the same time, there are other conditions, skin conditions that can mimic, let's say, eczema, that again, you want a provider to be able to see and make an assessment of your child and make a diagnosis. Now, for things like eczema, they are common, but it does not mean that they are normal. So what this means is that there is an underlying reason, there is a root cause for eczema. And by addressing and identifying that root cause, we can have resolution of symptoms and signs. This also means that often you will get a steroid cream for eczema, which is okay, right? We want to help the skin inflammation come down. We want to help baby feel better. They may be itchy, they may be uncomfortable. And I want you to know that that is a very short-term solution. And there are many other things that you can do, again, to identify and address the root causes of the eczema and not just apply this Band-Aid solution to it. The other thing to look out for is vomiting. So any vomiting, excessive vomiting, especially after a switch of formula, is a possible sign of a food allergy. Same thing with reflux. So reflux can look like excessive spitting up. It can also look like baby arching their back, often being very uncomfortable. Those are things to look out for. And really, we want to look at the whole clinical presentation of your child and see what are the changes. If it was a new formula that you gave and these popped up, then again, that helps with the diagnosis of a food allergy. And you really want to work one-on-one with a provider and possibly an allergist, especially if you are seeing signs of these hives, the other signs of anaphylaxis I'll mention as well, that are dangerous and you need to see urgent care or get to an emergency room as soon as you can, are where baby may be changing colors to looking blue. That is a lack of oxygenation. They may be having airway constriction, difficulty catching a breath, difficulty crying even. They may have the hives. They may have a sense of like panic, and you can see this in a baby as well. So these are just a couple examples of times when you absolutely need urgent care and you need emergency treatment. And what I want to let you know is that there are holistic solutions to these signs and symptoms that you're seeing. And I absolutely recommend working one-on-one with a provider to create a plan that is specific to you and your little one going forwards. Because often, I've worked with many families where the mom goes on Dr. Google and looks for information on there. And the problem with that is, or maybe you're on these Facebook groups and you get information from there. The problem is that that is just one person's experience. And like I mentioned before, there are many possible underlying reasons, underlying root causes to what you're seeing. So unless you're working with a provider who is specialized and skilled in this to work through the steps with you, then you may be jumping to conclusions and doing things that you may not need to do. So this is also the time that I want to mention that when you're seeing these things, if you are a breastfeeding mom, elimination diets are not the first thing that I want you to do. So again, working with a provider to make sure that you're not jumping ahead and doing more than you need to, and increasing the stress of your life and your family's life. So I highly, highly encourage you, if you are seeing these things, work closely with a provider, get custom care, custom guidance that is specific to you. And that is how my approach is different as well. With holistic solutions, we look at all of the root causes and we go through a root cause analysis. So what that means is we identify the problem, we understand the problem, we identify the root causes, we make adjustments, and then we monitor the system. And working closely together, we go through those steps multiple times, as many times as we need to, because there may be multiple root causes as well. And once we address the root causes, then we do get resolution of signs and symptoms, and our little ones do feel better. So I want to give you hope. I want to empower you that there are things that you can do. So I hope that this top 10 list was helpful for you. I hope that you feel that these are easy and actionable steps that you can go ahead and start doing right now. And I want you to feel empowered that there are ways to feed your baby, formula, breastfeeding, otherwise. Again, especially if you are interested in starting to relactate, that is another mini course that I'll be doing in the near future. So I will share resources with you as well, because there are so many options, and I do not want to see any babies going hungry with this formula shortage. It is devastating for the families, and my heart absolutely goes out to you, and I want to help as much as I can. So my name is Dr. Beata Harasim. Again, I am a holistic and integrative doctor of physical therapy, and I am here if you have questions, and I will be creating more of these mini courses going forwards. So I look forward to connecting with you, getting to know you and your little ones. And if there are any specific topics that you would absolutely like more information about, please let me know, and I can gear more of my mini courses towards that to help specifically help you in the areas where you need the most help as well. So as always, I wish you and your little ones all the best, and I will see you soon.